So, very good morning to all. We are going to start a new topic, degenerative spine diseases. We are going to see which are the diseases under this specific term, that is degenerative spine disorders. And we are also going to see, first of all, how much spine, normal anatomy, એક spine કઈ રીતે form થાય, also the vertebral column, which are the peripheral nerves and how whatever diseases, say for example spondylosis, or we are going to discuss about the disc prolapse, how they are going to affect these nerves, peripheral nerves. We will be least bothered about orthopedic signs and symptoms. We'll be more bothered about the neurological symptoms. In both ortho and neuro, you are going to study this disease. Yes, a disease તમે બંનેમાં study કરશો. શું કામ? It is specific to bones and the intervertebral disc, which is part of orthopedics. પણ એ compress કરશે nerves ને. Yes, neurons ne, and that is why we want to study it in neurology. What will be the signs and symptoms? We are also discussing about the physiotherapy, about also the medical management of the same in this topic. So starting it, first is the anatomy, most important. Anatomy of the whole vertebral column. So vertebral column consists specifically of 33 vertebrae. Yes, you already know the division: cervical, thoracic, lumbar, sacral. The spinal cord is housed in the vertebral column. It's continuous with the medulla below the pyramidal dissection and terminate as a conus medullaris at L2. So up to L2 or L3, it will be continued. Then later on, you already talked about cauda equina. Yes, that will be formed in the periphery. There are 8 cervical pairs of spinal nerves. We talked about it. Yes, cervical part, 8 spinal nerves. Cervical enlargement C5 to T1 gives rise to the rootlets from the brachial plexus, innervates the upper limb. We talked about this in peripheral nerve injury. Yes, C5 to T1. Everything will consist and form the brachial plexus, whole of brachial plexus. There are 12 thoracic pairs of cervical nerve, that is T1 to T12, which innervate most of the trunk. Specifically, they innervate the trunk region with sensory supply as well as the intercostal muscles, that is accessory muscles of respiration. There are 5 lumbar pairs of spinal nerves, L1 through L5. Lumbar enlargement L1 to S2 gives rise to the rootlets from the lumbar and sacral plexus, innervating the lower limb. So L1, L2, L3, L4, L5, S1 and S2. Up to this, L1 to S2 completely join થશે and E lumbar and sacral plexus બનાવશે, જે આપણા lower limbs ne easily innervate કરે છે, and all the movements and sensations are possible from the lower limb. There are 5 sacral pairs of spinal nerve, S1 to S5, innervating part of the lower limb and the pelvis. And the one is the coccygeal pair of spinal nerves. Yes. So you should be clear about the anatomy. Why are we so bothered about the anatomy? Because एक segment જે affect કરશે, say for example C5, C6 affect થયું, તો ત્યાંથી C5 nerve નિકળે છે. At that time, if it is being compressed, તો C5 ક્યાં innervate કરે છે, કોને supply કરે છે, sensory motor બંને, એના ઉપરથી signs and symptoms આવશે. Yes, so it is important for us to know at which part, at which level cervical spines, cervical peripheral nerves, or whole spinal peripheral nerves, they are where they are emerging out, and which nerves, which muscles they are being provided to. This is the level. So just below the occipital level, you can see cervical nerve exits above the C1 vertebra. C8 nerve exits below C7 vertebra. Now here you have to remember how each one of them is moving out. Yes, C1 વાત કરીએ તો ઈ C1 vertebra ની ઉપર, C1 spinal nerve, understand, C1 spinal nerve જે પાંચ છે spinal cord nerve, vertebra are bones. Yes, bone ની ઉપરથી નીકળી જાય છે. But when it comes to lower cervical vertebra, it exists below the C8 level. Yes, so C1 spinal nerve exits above the C1 vertebra. C1 start થાય એની પહેલા C1 spinal nerve નીકળી જશે. Moving down, you can see from C8 spinal nerve exits below the C7 level. So you can see here, at above the T1, there is no nerve that exits. Yes. After this, each and every one is exiting just below it, except lower part. You see? Yes. Up to T11, T11, T12, T12. Now here again, L1, you can see below L1 vertebrae, everything is exiting. Now here you see at L1 and L2, spinal cord is terminating. Spinal cord L1, L2 level at terminate થઈ જશે. પછી જે હશે that we term it as cauda equina. Yes. And of course, lumbar enlargement and brachial plexus enlargement. This is cervical segment enlargement that is responsible for brachial plexus formation. And for lumbar, it is more of forming the lumbar and sacral plexus that helps innervate the lower limb, and brachial plexus innervates the upper limb. Now coming to the main disease. Now that we are thorough, કે કયા લેવલે શું બધું, every cervical nerve, every sacral nerve, every lumbar or thoracic nerve is coming out at which segment, it will be clear to us કે કયા segment it affect થશે, vertebral column compression આવશે, તો શું problems થશે patient ને. Yes, accordingly will be the signs and symptoms of the disease. So gradual loss of normal structure and function of the disc over time, that is termed as degenerative disc or degenerative spine diseases. Degenerative disc or degeneration of any part of the vertebra is common in two conditions. First is always age-related changes. You will be seeing as the population grows older, more and more individuals come to you, and you have to treat specifically those patients with cervical or lumbar diseases. The fluid within the nucleus pulposus, second most important is nucleus pulposus. Yes, gradually dries out and the disc loses the hydration, offers less cushioning and becomes more prone to cracks and tears. So nucleus pulposus is like a center. Yes, this center contains 70% of water. When it becomes dehydrated, like a water content and ochu thai jase, at that time specifically, small amount of compression from the, what is the function of disc? First of all, disc is present between two cervical or any vertebrae. Yes. તો અહીંયા એક ડિસ્ક છે, એ ડિસ્કનો સેન્ટર પોર્શન છે ન્યુક્લિયસ પલ્પોસસ. ન્યુક્લિયસ પલ્પોસસ ઉપર pressure continuously આવે. Yes, if I am sitting right now, it is continuously under pressure because of gravity. Yes, gravity is trying to pull it down continuously. એટલે ડિસ્ક ઉપર pressure આવે છે. It is able to maintain the space between the two vertebrae because the nucleus pulposus is hydrated. Yes, જો એ હાઇડ્રેશન ઓછું થઈ જાય તો easily compress થઈ જશે. easily compress થઈ જશે તો બંને વર્ટિબ્રા વચ્ચે જે જગ્યા છે, yes, intervertebral space, that will decrease. If it decreases, then spinal nerves or any peripheral nerve that is coming out from this will get compressed. And if it gets compressed, there will be signs and symptoms. That is why it is important for us to understand the anatomy and link it to the disease. There is a natural part of aging with all people will exhibit changes in their disc, but not all will develop symptoms. Is variable in nature and severity. Age સાથે muscles weak થાય, neurological symptoms આવે, we have seen in the dementia. Yes, everything comes, but it is not necessary કે બધાને symptoms આવે. Yes, because the disease depends on the nature and severity also. કોકને compression હોય 2 mm નો, કોકને compression હોય 8 mm નો, zero space હોય, એવું પણ બને. Yes, so એમને symptoms વધારે આવશે. And nature also, if you are used to taking pain, then you will not feel pain. Pain gate theory. Yes, pain depends on various reasons, various factors. So એનાથી ખબર પડશે કે patient how much they will be able to sustain or what will be the pain threshold જે લેવલે pain experience કરવાનું start થશે. That all depends on person to person, individual to individual. That is why બધાને સરખો pain નહીં થાય અને એક જેવો pain નહીં. That is the main thing. Pathophysiology. Yes, most important. As we talked about, dehydration of nucleus pulposus will lead to changes. But there are also stages, and we are going to see the diseases, both the diseases specifically, in which what changes occur. So first, by the third decade of life, that is in 30 plus years, the nucleus pulposus becomes replaced with fibrocartilage. Fibrocartilage is nothing but a structure which replaces normal nucleus pulposus, but is not having enough strength to sustain the intervertebral pressure. જે pressure ઉપરનો vertebra અને નીચેના vertebra ઉપર exert થાય છે, એ pressure nucleus pulposus જ sustain કરી શકે, લઈ શકે. પણ જો એ convert થતું જાય fibrocartilage માં, તો slowly and steadily pressure એટલું કરવા માંડશે કે IV disc છે એની size decrease થવા માંડશે. The distinction between the nucleus and annulus becomes blurred. The proteoglycans, water, the non-cartilaginous protein concentration decreases while the collagen concentration increases. Collagen is again something that is forming the ground substance of all the cells or tissues, we can say. Proteoglycans, water, and non-collagenous proteins, these are the main contents of the IV disc. Yes, જો ઈ ના હોય તો તો એ સસ્ટેન ના કરી શકે, એટલે ધીમે ધીમે રિપ્લેસ થઈ જશે ફાઇબ્રોકાર્ટિલેજ થી. ફાઇબ્રોકાર્ટિલેજ થી રિપ્લેસ થશે, સસ્ટેનેબિલિટી જે હતી, પ્રેશર લેવાની જે કેપેસિટી હતી, ઓછી થઈ જશે. The increase in the collagen concentration is more pronounced in the nucleus and in the posterior quadrants of the disc. It is more pronounced with age and more caudally, moving superiorly. Cervical region most affected, yes, at this point. And slowly and steadily, when you move downwards, it increases. Why does it increase? Because the pressure, cervical ઉપર કોનું pressure છે? ખાલી head નો. Thoracic ઉપર cervical plus head. Lumbar upper, thoracic, cervical and head. So when you move downwards, the pressure increases. Yes, and the gravity starts acting more and more. ઘણા બધા vertebra ની એકસાથે compression આવશે. But also with this, we need to take in consideration the anatomy of each and every cervical, lumbar, thoracic and sacral vertebrae. At this point, we should realize that the mobility is more at the cervical and lumbar. Cervical and thoracic. And lumbar is mainly for stability. So cervical and thoracic are less prone compared to the lumbar region. Yes, why? Because lumbar itself is made for stability. Stability joy એટલે mobility ઓછી હશે, mobility ઓછી હોય અને એમાં જો compression થાય, so there are chances it will be severe. Yes, you might have heard the term sciatica. Yes, so it is nothing else but movement of sciatic compression of the sciatic nerve at the lumbar level. Yes, and that can lead to various signs and symptoms in the whole lower limb. So that is sciatica. Same thing we are going to discuss. Yes, so cervical degenerative disc. Yes, you can see here specifically all the peripheral nerves are originating from the spinal cord. Here, because the intervertebral disc is less and there is more of movement of annulus fibrosis moving outwards, nucleus pulposus moving outwards, it is leading to compression of this peripheral nerve. Compression thase એટલે sign and symptoms આવશે. Muscle weakness થઈ જશે, pain would be the first sign and symptom, not just localized in the whole course of the nerve. જ્યાં પાણી nerve supply કરે છે, dermatomyotomes affect થશે. Yes, so that is why we need to check for each and everything in that patient. So cervical degenerative disc disease is often present with other spinal condition, either at the same time or in some cases one cause the other, such as cervical disc prolapse, cervical spondylosis. Both this we are going to see in detail. એટલે એકલું cervical degenerative disc નહીં હોય, એની સાથે associated always there will be cervical disc prolapse or cervical spondylosis. First, cervical disc prolapse. So in a spine condition of the cervical segment that occurs when a gel-like center of the disc, nucleus pulposus, the center of the IV disc, intervertebral disc is nucleus pulposus, as we have discussed, ruptures through a weak area and through the outer wall, that is annulus fibrosis. So you can say in the center is nucleus pulposus and in the surrounding of this is annulus fibrosis. Annulus fibrosis jo weak thai because of the continuous pressure, that is termed as disc prolapse. Prolapse means nikdi jawun. Causing irritation and or compression of the adjacent nerve root. એટલે જે પણ nerve root ત્યાંથી exit થતી હશે એને compression આવશે, because the space between the two vertebrae decrease because the IV disc has become prolapsed, that is moved out. The disc herniation occurs more frequent as C6 and C7 level because mobility is more. જેટલી mobility વધારે, maximum mobility you can say is in the cervical region and specifically at the lower cervical region. That is why it is more common that you see more of disc prolapse at this level, C6, C7. Pathophysiology. So herniated disc may occur when there is enough pressure from the vertebrae above and below. તો જે vertebrae છે એના ઉપરથી અને નીચેથી એની ઉપર continuously pressure તો આવે જ છે. Second, this force can sum or all the nucleus pulposus through a weakened or torn part of annulus fibrosis. Annulus fibrosis જે surrounding ring છે એમાં કોઈ પણ એવો part હશે જ્યાં weak છે તો nucleus pulposus એ બાજુ જશે. Yes, it will slightly move અને annulus fibrosis ને તોડીને પાડીને બહાર નીકળી જશે. Yes, that is more of pathophysiology for this. So there are four main stages. પહેલા herniation થશે, પછી બહાર જશે, એકદમ breakout થશે અને એકદમ બહાર નીકળી જશે. The four stages. So first is disc degeneration. Because of weakness, annulus fibrosis માં weakness ક્યાંથી આવશે? Degeneration ના લીધે. Degeneration થશે, પછી start થશે prolapse. Third is extrusion. Extrusion એટલે બહાર નીકળી જવું. Yes, and fourth is sequestration. એ બહાર નીકળી ગયા પછી કઈ બાજુ nucleus મૂવ થાય છે, that is also important. જ્યાં મૂવ થશે એ પ્રમાણે સાઇન્સ એન્ડ સિમ્પટમ્સ આવશે. So first is degeneration. કોઈ પણ ડિઝીઝ સ્ટાર્ટ ક્યાંથી થશે? કોઈ એક પાર્ટ વીક થશે. વીક થશે તો જ ન્યુક્લિયસ એ બાજુ મૂવ કરવાનું સ્ટાર્ટ કરશે. So degeneration, chemical changes associated with aging cause disc to weaken but without a herniation. Herniation એટલે આખું ન્યુક્લિયસ હજી સેન્ટરમાં જશે, કનેક્શન હશે સેન્ટર સાથે, and slightly it will start moving outwards. Prolapse. Prolapse means continuously એકદમ સેન્ટરમાંથી એકદમ સાઈડમાં આવી જશે, પેરિફેરીમાં આવી જશે. The form of position of the disc also with some slight impingement into the spinal cord, also called a bulge or protrusion. Yes, protrusion. Protrude. To protrude means barjo. Yes, to move to the periphery. Third is extrusion. Extrusion એટલે annulus fibrosis ને એકદમ તોડી નાખશે અને બહાર નીકળી જશે. A gel-like nucleus pulposus breaks through the tire-like wall, that is annulus fibrosis, but remains within the disc. Still, ખાલી boundary તોડી નાખી છે, ઈ છે તો હજી ડિસ્કની અંદર જ. ડિસ્કની બહાર જશે, that is the last sequestration. The nucleus pulposus breaks through the annulus fibrosis and lies outside the disc in the spinal canal. Yes, so that this herniated nucleus pulposus. So nucleus pulposus એકદમ બાઉન્ડ્રીની બહાર આવી જશે અને it can move posteriorly, anteriorly, superiorly, inferiorly, અને જ્યાં એ મૂવ થશે એ પ્રમાણે સ્પાઇનલ નર્વ્સ ડેમેજ કરશે, એ પ્રેશર આપશે સ્પાઇનલ નર્વ્સ અને સાઇન્સ એન્ડ સિમ્પટમ્સ ઓરિજિનેટ થશે. Now direction, as we talked about, in which direction it can move. Yes, so first is most common posterolateral, પાછળ અને બહારની બાજુ, posterolateral, that is 70%. It occurs in the posterolateral direction because the posterior longitudinal ligament prevents direct posterior herniation. Direct posterior ના જઈ શકે ભાઈ, because the ligament is there to hamper it. એકદમ posterior ના જઈ શકે એટલે posterolateral જશે. The herniation will compress on the adjacent nerve root at that level. જે પણ nerve root originate થતી હશે almost below the level જે આપણે વાત થઈ, C1 to C7 is above. C8 થી બધું જ નીચેની બાજુ originate થાય છે. So from that region specifically, each and every nerve root can be get compressed. જે પ્રમાણે IV disc, for example T1 T2 વચ્ચે થયું તો T1 ની નીચે કઈ નીકળે છે? T1 spinal nerve. Yes, so that will be affected. The signs and symptoms will be specific to myotome and dermatome of T1. The herniation will compress on the adjacent nerve root at that level and causes predominantly motor changes. Specifically, most of motor changes are and later on there will be sensory involvement also. Depends on the spinal nerve. They are all of mixed type. Second, central disc prolapse. Yes, first was posterolateral. Now second is more central disc. Center ma disc move thai. Cervical disc herniation direct posteriorly, causing compression of the adjacent cervical spine, which is a neurosurgical emergency, result in cervical myelopathy. Now it is very important because જ્યારે પણ સેન્ટ્રલ થશે એટલે એક્સ્ટ્રીમ પોસ્ટીરિયરલી જશે એટલે આખી સ્પાઇનલ નર્વ સ્પાઇનલ કોર્ડને કમ્પ્રેસ કરી દેશે. યસ, પોસ્ટીરિયરલી મૂવ થાય એટલે આખી સ્પાઇનલ કોર્ડ કમ્પ્રેસ થઈ જાય. સ્પાઇનલ કોર્ડ કમ્પ્રેસ થઈ ગયા એટલે નીચેના સાઇન્સ એન્ડ સિમ્પટમ્સ, આઈ મીન નીચેનું મોટર કંટ્રોલ, સેન્સરી કંટ્રોલ બધું જ લોસ. યસ, લાઈક સ્પાઇનલ કોર્ડ ઇન્જરી. સ્પાઇનલ કોર્ડ ઇન્જરીમાં જે આપણે રીતે વાત કરી હતી કે જે લેવલે ઇન્જરી થશે એના નીચે બધું there will be blockage. Yes, paraplegia type signs and symptoms. So if this happens, depending on which level it is, નીચેના બધા જ nerves, peripheral nerves, spinal peripheral nerves બધી જ block થઈ જશે. બધી block means high amount of chance that the patient will be disabled. અને એ બધું block થઈ જાય. So we need to decompress it. Spinal cord જે compression માં છે એને decompress કરવું પડે. કઈ રીતે? Through surgical intervention. અને ના કરીએ then it is deadly. It can lead to the death of the patient also. Also, it terms in cervical myelopathy. Yes, cervical. Yes, specifically we are talking about the cervical disc prolapse. So if it happens in cervical, all the things that will lead to quadriplegia. Cervical myelopathy. Myelo related to spinal cord and pathy, abnormality in spinal cord. Yes. So any abnormality in the cervical spine because of the compression, because of the movement of the IV disc posteriorly, that will term as cervical disc prolapse, which is main emergency condition leading to cervical myelopathy. Yes, so here you can see more specifically this level, ekdam normal. Yes, moving down here you can see it has started protruding, and here you can see it is moving backwards at the end region. You can see here very clearly. This is again normal. This is again to a point, yes, it is extruding. Here it is protruding, completely protruding. Yes, so two levels. Here you can see first is this here, leading to compression, and second is here. Yes, leading to compression over the spinal cord. If it moves continuously posteriorly, जो posteriorly जैसे spinal cord ने injure करसे, तो cervical myelopathy होय, and it is an emergency condition. We need to take the patient to the hospital and get it decompressed. Otherwise, the patient's life is at stake. Yes. Uh, so sagittal magnetic resonance imaging, as we saw in the cervical intervertebral disc protrusion C3, C4, and C6, C7. So here we first saw it, 3, 4, and 6, 7. Here we saw it. Yes, that is between the two vertebrae. It is getting extruded or protruded, first of all. What is the cause of this? The main cause is injury, improper lifting, and aging. Aging, again, non-modifiable. આપણે કાંઈ modify ના કરી શકીએ. But injuries can be prevented, and specifically improper lifting techniques specifically can be taught to the patient who use or who are used to lift heavy weight with their with walking or with their stance in straight position. So instead of bending the back, yes, what we can ask the patient, bend the knees and sit and take the weight, whatever they have to, lift the weight, whatever they have to. If you bend forward, there are chances the annulus fibrosis will get degenerated and the nucleus pulposus will move out. Nucleus જે છે annulus ની બહાર જશે અને કયા ડિરેક્શનમાં? પોસ્ટિરિયરલી. જેટલું વધારે પોસ્ટિરિયર જશે એટલા ચાન્સ વધારે કે જલ્દી તમને સર્વાઇકલ ડિસ્ક પ્રોલેપ્સ થશે. Yes, cervical as well as lumbar. Yes, lumbar is also prone, specifically L34, L45. These two levels are more prone for disc prolapse. So injury, yes, any injury, any type of injury, even spinal cord injury can lead to such things. Additional with spinal cord injury, we will have disc prolapses. Yes, fracture થશે, fracture સાથે associated disc prolapse હોય, and disc prolapse ની સાથે spinal cord injury થાય. All these are combined terms that can happen together. Risk factors, yes. So કોઈ પણ વસ્તુ જે annulus fibrosis ને weak કરે, that is a risk factor. Yes, annulus fibrosis જો weak ના થાય તો ન્યુક્લિયસ બહાર મૂવ નહીં થઈ શકે, outside move નહીં થાય, that means spinal cord ને compress નહીં કરી શકે. Yes, so lifestyle choices such as tobacco use, lack of regular exercise, inadequate nutrition subsequently contribute to poor disc health. Disc health is main. Yes, specifically even dehydration. જો water content પણ ઓછું થઈ જાય ન્યુક્લિયસમાં, this can also directly lead to prolapse. So first is tobacco use. Yes, so if an individual is using increased amount of tobacco, they are more prone for IV disc problems. Second, lack of regular exercise. If people or any individual is not exercising regularly, that is maintaining the mobility of the spine, that will also lead to more chances of disc prolapse. And inadequate nutrition subsequently contribute to poor disc health. Poor posture combined with habitual use of incorrect body mechanics can place additional stress on the cervical spine. I'm not sure at this point how many of you are sitting straight and listening. Most of you will be down. So that is also one of the risk factors for any disc prolapse. If you are maintaining poor posture for a prolonged period of time, yes, for 1 or 2 days you follow good posture and then again for years you follow bad posture, so there are many chances it will happen. Disc prolapse may happen. You are at risk of having disc prolapse. With habitual use of incorrect body mechanics can place additional stress on the cervical spine. So these things can place additional stress. If you are lying down supine, that is fine. But if you are in semi-floor position or any other position between supine and sitting, at this point, you have to see which level of the spine is getting maximum amount of tension because of the gravity and because the position of the vertebrae as such. It can lead to extrusion of the nucleus into the annulus fibrosis. Okay, we'll keep it till here. Yes, in symptoms and the main assessment part we'll discuss in the second lecture at 11:15. Probably we'll be completing this whole topic in 2 lectures. Yes. Any doubts so far? We'll just revise. So first we talked about the anatomy, 33 vertebrae, starting from the cervical, thoracic, lumbar, sacral, and 1 pair of coccygeal. Each cervical vertebrae is moving first C1 to C7 moving upwards, C8 થી બધું જ નીચે, one segment downwards. L1, L2 is the end of spinal cord when N1 and L2 complete at the spinal cord. After that, whatever the peripheral nerves are there that move in the spinal canal, These are termed as coda equina. Degenerative disease, main two factors. First is age, and second most important is nucleus pulposus, health of nucleus pulposus. If it gets dehydrated, then there are chances that it will move out of the annulus and cause various signs and symptoms. So that is what we talked about pathophysiology also. In cervical, we talked about two main conditions that we will be seeing. First is the dysprolix and second is spondylosis. Spondylosis is nothing else but breakdown of the whole cervical spine, and that will lead to more signs and symptoms because it is a degenerative disorder that happens with age. First, cervical disc prolapse, we saw it at most common at C6, C7 level, and annulus fibrosis gets degenerated, nucleus pulposus moves out. There are four furthermore stages that we described: this degeneration, sequestration, that is prolapse, extrusion, and sequestration. Yes, all the four we already described. Any doubts in this? And prolapse is common in posterolateral direction, very less common in central, that is posterior direction. And we saw an example, and the cause and the risk factors. Cause is injury. Cause can also be improper lifting and aging. And risk factors will be lifestyle changes, posture, lack of regular exercise. These three are the main ones. Yes. Any doubts you have regarding the same? Please write in the chat.